Hello, my name is Dr. Joanna Oda, and I'm an Associate Medical Officer of Health with Halton Region Public Health. Welcome to another episode of Keeping Halton Healthy. Today we'll be talking with local experts to answer some common questions from families about the COVID-19 vaccine for children aged 6 months to under 5. There's a lot to cover, so let's get started.
Some of the main risks that we see in children ages 6 months to 5 years old with COVID-19 are similar to the same risks that we see in adults.
However, a small but important proportion will have severe disease, and that may require hospitalization. And about half those children have no underlying medical conditions. They were perfectly healthy before they contracted COVID-19.
Particularly in this age category, we do see some children who develop a condition known as multisystemic inflammatory disease.
And this is a condition that we are seeing in children where the virus can impact other organ systems of the body, including the lungs, the chest, and the kidneys.
What's healthy for children, I think, going to school, being with their friends, being with grandparents is all extremely important. And by getting vaccinated and decreasing their risk, we're allowing them to sort of get back to a normal life.
And even if a person or a child is to get infected, we know that it protects them against severe outcomes.
Most children under the age of 5 will only have mild symptoms with COVID-19 and will recover fully. However, a small but important proportion will have severe disease, and that may require hospitalization. The vaccines are safe and effective and lower the risk of severe disease even in children.
As a pharmacist and being a parent myself, I am telling my friends and family and other parents to get their children protected. You can go to see a doctor's office if you've got a child under the age of 2 or older, and if your child is 2 and above, a pharmacist or even a public health clinic can help you as well.
I have 2 children under the age of 5, and it was a huge relief to know that they now had that protection after I got them vaccinated.
I believe in immunizations strongly, and I think that this is the one thing in the last several decades that we've done really well. We've prevented diseases like diphtheria, tetanus, polio, and COVID-19 vaccines give us an opportunity to control severe disease.
We are expecting a challenging respiratory season this year. It's hard to predict which children will have more severe disease, and knowing that there's a way to protect children against that disease through a safe and effective vaccine means that it's worth taking advantage of that.
Simply put, vaccines are the best way to protect your child from COVID-19.
We know that the immune response from vaccination is far greater than that of natural infections. So that means, in layman's terms, that you have more immunity after you've been vaccinated than if you've just had the infection naturally.
Immunity from disease provides some protection against future reinfection. However, like protection from vaccine, that protection wanes with time. So we recommend that children who've had COVID-19, the disease, do get vaccinated 8 weeks after they either tested positive or their symptoms began.
There's a lot of misinformation out there, so I caution my patients and urge them to use reliable sources.
I would suggest reaching out to your family physician. They probably know you the best and can give you information. They can also redirect you to many of our sites. Sick Kids has a great site on vaccine questions. The Halton region has a great website as well, which can answer some of the questions that you may have.
So if you're looking for information, please make sure you're using reliable resources, and you can find a list at halton.ca/COVIDvaccines.